Welcome to AI IRL. In this podcast, we delve into the exciting world of artificial intelligence and its transformative power in revolutionizing patient care.
Welcome, listeners. Join us as we explore how artificial intelligence is revolutionizing healthcare, particularly within the realm of digital health and hospital systems, from streamlining administrative tasks and improving patient flow to enhance clinical decision-making and personalizing treatment plans. We'll discuss the latest AI-powered solutions transforming the way healthcare is delivered, managed, and experienced, while considering the challenges and opportunities that lie ahead. Let's start with some introductions.
Thank you, Karen. I'm Angel Shew. I'm a healthcare technology leader with over 20 years experience driving innovation and digital transformation across major U.S. health systems. I'm currently consulting for a major U.S. health system to develop strategic plans for rolling out AI-enabled workflow automation tools for improving patient care and reducing burnout for their providers. Prior to that, I was designing future healthcare systems for hospital and ambulatory settings for UCSF and Stanford Healthcare and Kaiser Permanente. I was formerly CIO for Kaiser Permanente San Mateo region to medical campuses. And I'm delighted to now introduce Prerna.
Thank you, Angel. Hi, everyone. I'm Prerna Anand. I'm a product manager with over 8+ years of expertise building products for patients, providers, hospital systems, and payers using artificial intelligence and machine learning, data analytics, and digital health. My most recent project was I built a data pipeline for referral management in a large hospital. Prior to that, I've built AI/ML powered tools for insurance claims management. And my superpower is translating user speak into technical requirements and vice versa, which is very, very pertinent in the world of AI now. Let's get started. Karen.
Hi, I'm Karen Vincent, a product leader with more than 10 years of experience in data-driven decision-making and digital transformation in healthcare. My focus is on readiness, governance, and performance metrics, helping organizations unlock the full potential of AI to improve patient outcomes and operational efficiency. I'm excited to share insights on how to effectively measure the impact of AI in healthcare and navigate its challenges.
Great team. So let me get started with you, Angel. My question to you is about operational efficiency and patient care. How can AI and digital solutions enhance hospital operations and alleviate staff shortages?
Well, thank you, Prerna. Well, AI and digital solutions are game changers when it comes to healthcare, especially easing staff shortages and helping improve efficiency. First of all, AI-powered automation can help handle administrative tasks like scheduling, documentation, and patient data entry, freeing up nurses, doctors, so they can focus more on patient care. It can also provide predictive analytics, helping hospitals anticipate patient surges, optimize staffing, reduce patient wait times in emergency rooms. Virtual health assistants and chatbots can answer patient questions, schedule appointments, and even provide basic medical guidance, reducing, again, the burden of frontline workers. Additionally, AI-driven remote monitoring tools can help doctors track patients' vital signs in real time, help prevent hospital readmissions, and keep beds available for those who truly need them. And I can go on with a lot of great examples, but my personal favorite is working with Dartmouth Hitchcock Medical Center, where we utilize Masimo's patient safety net to monitor and notify providers alerts on patients' conditions, specifically in the med-surg floors. And the result of that case study, we showed a 65% reduction in distress codes and activations and 48% decrease in patients into ICUs. So that was a total savings of 135 ICU days and $1.5 million.
Wow, that's incredible.
So my next question is for Karen. How do you address challenges in healthcare data, such as data silos, quality issues, and incomplete records?
Thank you, Angel. This is not easy. Most organizations we work with have wildly dirty data. So we start by just wrapping our arms around where we are now with the data and developing a plan to arrive where we need to be for successful AI implementation. So we look at data cleanup, reprocessing, breaking down the silos to bring the needed data together, automating the data quality monitoring, validation rules, anomaly detection. The most important thing is to ensure that there's a human in the loop who understands the pipeline and the issues it suffers. It can really feel a bit insurmountable for organizations, but I really want to reassure you that the data issues are prevalent, but it's not a deal breaker for AI/ML implementation. There's a path through with data cleaning, pre-processing, integration techniques, automating the validation and monitoring and human oversight. In the worst case scenario, when problems can't be addressed, there's always a way to streamline the operations through role-based automations and workflow improvement strategies. That can also reduce costs and improve outcomes. Prerna, I was just wondering if you could answer for me, what factors go into determining the most appropriate AI solutions for a specific healthcare challenge?
Question, and both of your answers are so relevant to this question. So, when it comes to picking the right AI solution, everybody wants one, but there's no one size fits all approach. It's about finding the right fit for your specific solution. And even before that, asking, do I really need AI for this? So first and foremost, you've got to be, as a hospital system, as a healthcare provider, you have to be crystal clear about what problem you're trying to solve. Are you looking to reduce diagnostic errors, improve patient scheduling, improve patient experience, cut down administrative work? What is the actual problem you're trying to solve? Because many solutions, when you start looking at them, are designed to solve one specific issue. Then you have to think about the nuts and bolts. Will this system play nicely with your existing tech stack? Are you going to create more headaches for your staff? Or are you going to create more work for them to fit this new tool into their workflow? A lot of technologies fail because adoption is a pain to get users to use them. And then, of course, in healthcare, patient outcomes are paramount. So we need to look at solutions that have a track record of actually improving care. Most shiny toys are talking about safety, but you want to make sure that the system you're introducing does not introduce new risks. You have to think about costs. You have to think about impact on staff morale, overall quality of care, patient satisfaction. And then you also have to consider the regulatory side of things. So any solution that a system picks up has to tick all the boxes when it comes to compliance and ethics. And that's not an easy thing to do. And then think about the future. It's not about, oh, I've implemented a tool and it's there forever. Healthcare is evolving, AI is evolving. So you want a solution that you pick to grow and adapt with you. So there's a lot different layers in there for people to actually consider when they're thinking about what to do next. On that note, Karen, I'm going to kick this question back to you. How do you measure the success of an AI/ML implementation?
Prerna, your answer really resonated with me quite a bit. It's all about the reasons, what you're actually trying to accomplish. And that is so true with the measurement as well. Success is really dependent on the reasons for the project. So use case, outcomes desired, could be any combination of goals around time savings, cost savings, adoption, scalability, patient engagement, outcomes, improvement in the workflow, or readmissions before and after implementation. So when I work with an organization, I ensure there's a lot of careful planning around the measurement so that we can address the data availability and quality concerns up front so that the ROI and the total cost of ownership are easier to measure on the back end. So Angel, I'm just wondering, what strategies would you employ to gain buy-in from clinicians and other stakeholders for AI adoption in healthcare?
Yeah, that's important consideration for success of AI. So I'm glad you asked that question. It comes down to trust and building relationships with clinicians and your stakeholders. and you want to show them how AI can solve their biggest pain points and can do so without adding complexity. To your point, Purna, you don't want to add more stuff to their plate. First, you want to start with really small, practical use cases, demonstrate clear benefits, without, again, adding burden. And that can be done showing reducing paperwork, improving diagnostic accuracy. Second, we can involve healthcare professionals early on in the decision-making process. Let them feel part of the planning and design of that solution. Listen to the concerns. And to your point again, Perna, you talked about making sure we get to their addressing their problems and understanding the root cause. We also want to provide training and support to the staff so they feel comfortable using the technology. And lastly, transparency is absolutely critical. You want to show hospitals, your providers, how AI is making the decisions, how it's safe, and that we're leveraging human expertise, we're not replacing it. So again, by building trust, proving AI's value in this real world, adoption can be a natural step rather than a forced change. So my next question is for Perna. How do you ensure ROI with healthcare organizations adopting AI solutions?
Great question. As you said, building trust and showing value for patients is not just enough. You have to show the dollar numbers. But ROI is not just in dollar numbers. You have to look at things holistically. On the financial side, we're obviously interested in cost savings and revenue boost. So we've worked together at UCSF where we implemented an automated scheduling system. It wasn't an AI scheduling system, but even that scheduling system cut down the no-show rates for the pilot clinics by almost 50%. That's easily to translate in significant annual revenue. Add an AI angle to it, and the revenues can actually be much more higher. But it's not just about the money. We are looking at operational improvements. Automated or AI-assisted triage systems in ERs can cut wait times, research has shown, which means treating more patients and potentially saving more lives. Then there is the clinical side. Diagnostic accuracy is making huge strides using AI. There is an algorithm for mammograms that's boosting early detection rates for breast cancer by almost 15%. That's a huge number in terms of patient outcomes. And then for any hospital system, like any other business, and I don't want to call hospitals business, but ultimately it is, we have to look at the long-term strategic value. Hospitals that are early adopters of technology, including AI, are seeing increases in market share because patients are actively seeking out these cutting-edge treatments. So it's not just about immediate financial return. It's about long-term benefits in patient care, operational efficiency, and strategic positioning. And in my experience, when hospital organizations take this comprehensive approach to measuring ROI, not just in dollar terms, but also long-term strategic gains, they often find benefits that the initial ROI that they had predicted was less than what they actually end up getting.
That's great because you're right. It's not just about the ROI, the bottom line. It's about sustainable impact.
Yeah, which always comes up is about the challenges and ethical considerations when we start talking about AI. So, Karen, any thoughts on that?
Yes, quite a few actually. AI in healthcare holds so much potential, but the implementation has so many challenges around data, privacy, and bias. You need a robust governance framework, secure data sharing protocols, and a lot of transparency, especially in how the models are interacting, any disparities that you can detect, and how the patient data is being used. You really have to address it up front and throughout the course of the project. It requires diverse representative data sets, continuous model auditing, and explainable measures to ensure fairness from an ethical standpoint. AI should enhance and not replace humans. We've all been saying throughout our conversation here today, humans need to be involved in order to ensure that it's functioning in a fair, ethical, and equitable manner. So I really feel strongly that clinicians need visibility into how the recommendations are being made in AI. We also have to consider patient consent and ensuring that really this is being used to support and not dictate care decisions. So this whole balance that we have to juggle in order to make this thing happen is really quite a lot.
Is indeed. Angel, what are your thoughts? This was very heavy.
Oh, yeah. I mean, we can all talk about designing, planning, the perfect solution, but it all comes down to execution. You're right, Karen. That's where the rubber meets the road, and it comes down to how well we actually understand our current state and try to integrate the solutions. It's not about shoving a solution in a, common saying, a round circle into a square peg, but we really have to be thoughtful and ensure stakeholders, clinicians buy in all the way. And in the end, change is about helping them embrace the transformation and change to day-to-day workflows. So I think we do have a lot of hope, but understand the challenges are in front of us and realize that it's going to take a village, a whole system to embrace and make this happen. So I'm optimistic about our future.
That's right. And I agree. There's great potential. And once we get the stakeholder buy-ins from like clinicians and hospital organizations, it will be very easy to start. I won't say easy, but it would ease the process of implementing. However, I do have another challenge in that I keep seeing is everybody wants to do everything AI. And there are some things where you don't need AI for. And AI is not a new thing. Machine learning and what we call augmented intelligence or artificial intelligence has been around for a while. So the hype around it is creating another layer of bias that people think everything has to be solved with AI and something that doesn't fall under fully AI but is more automated can fall under the cracks and might be a better, lower cost, easier to implement solution. So there's that. And then we can't ignore the bias issue. If there's the learner's bias, the creator's bias, the demographic bias, the data bias, and now the political bias, everything else we have to be very, very aware of when we are thinking about these tools. It's an interesting world we are living in. Future of AI. What do you guys think? Give me any predictions that you have. Angel, do you want to start?
Sure. I believe this is going to be the most transformation we're going to see in our healthcare system. I'm optimistic that this is going to help us leapfrog and versus what we've been doing in the past is kind of walking, but really leapfrog the competition, the marketplace, and we're going to see a lot of shakeout in terms of health systems, providers that thrive into this next decade. Actually, maybe even sooner. It could be just a matter of years where we're going to see a lot of hope. I'm hopeful of value that we expect to come from our healthcare system. And again, it comes back to patients. I know that's talked about a lot, but ultimately it's about empowering patients to make decisions and enabling to have the data insights they need to do that.
Karen, what are your thoughts?
Yes, for me, I see this evolving rapidly, but I'm really most excited about is the potential to embed AI safely into the clinical workflows and streamline access to care in a way that brings patients into their first appointment sooner with less time and effort from staff. There is a potential to improve the match so that clinicians are practicing at the top of their license and patients are also receiving the best care sooner than before. And I find that just really, really exciting because it can improve both the outcomes and the satisfaction, potentially even save lives. On the flip side, though, what concerns me is the gap between AI and the real world implementation. So while we're getting closer, there's certain cases where we're just not addressing the barriers around transparency, bias, and usability. And there's a risk that poorly implemented AI could lead to unintended harm. I think that navigating the future is working to ensure that it remains patient-centric, explainable, and safely, seamlessly embedded wherever possible.
I agree. And I share your slightly pessimistic concerns about the future. I'm worried that a new version of don't compare your 10 minutes of Google search to my 20 years of medical education is gonna pop up and it would become don't compare your LLM to my experience of actually handling patients. But I'm equally excited about how it will up the game for patients, as you said, Angel, and as you said, Karen, that putting the clinicians to give the best care possible, because the patients are now the drivers of their care, are more educated, are more informed, will actually change the way healthcare is delivered. And my hope is that we turn towards preventative care more and more than be just prescriptive care of taking care of our sick, and instead work towards preventing them from becoming sick. That's my hope.
Absolutely.
So Angel, do you want to close us with some closing remarks?
Yeah, I appreciate Karen, Prerna working together, UCSF, and come together in the podcast to share all of our insights about AI and digital solutions. So I am hopeful about our journey together going forward, and we just want to share all these lessons and encourage others to collaborate with us, and hope there's some value to listen to our podcast here.
I agree. This has been an awesome time spent with you talking about the real world applications of AI in healthcare and the trials and tribulations from our past experiences. I'm hoping that this will inspire others to jump in and then maybe also learn some things from our cautionary tales as well.
Know why you're using AI and what you want to measure. Beware that AI is just a technology and not a magic wand. And know that it's inherently biased, so use your judgment. Those are the three main things that I would take out from our discussion today. And if you all want to send us your questions, please connect with us on LinkedIn, drop us a message with your questions, and we hopefully will collect all of them and create another episode with some more thoughtful conversations with this amazing group of people. Thank you, Angel. Thank you, Karen. And thank you, everyone, for your time.
Thank you.
Thank you. This AI IRL episode of Principles of Healthcare is produced by Prerna Anand, Karen Vincent, and Angel Shew. This is Volume 1, Episode 1, Considerations in AI Projects in Healthcare. Media editing by Karen Vincent. Background music by Artificial Intelligence. Audio source, Music Revolution, licensed through Adobe Stock. Special thanks to our listeners, mentors, and the healthcare community for your support. We'd love to hear from you. If you have questions, topic suggestions, or potential guest recommendations, please visit bit.ly/AI-IRL. Stay connected. Follow us on LinkedIn and use the QR codes on the credits page to connect with Prerna, Karen, and Angel. This is Karen Vincent, signing off. Thanks for listening, and we hope you'll join us again soon.